Today we are with Dr. Wasserman with Skin Wellness Physicians, where they are committed to maintaining the health and beauty of your skin. Dr. Wasserman, how do you approach an aesthetic patient?
We like to introduce the patients to the way physicians think and compartmentalize the approach to aesthetic medicine. I usually like to introduce patients to the 4 R's of aesthetics. The first R refers to the regimen or skincare regimen that a patient uses. I often will provide the analogy that this is like training for a marathon. All of the procedures we're doing are like an athletic event, like a 5K, a 10K, maybe even a marathon. But you don't just show up for those events ready to do it. You actually have to prepare for it. Now, we all exercise. That helps our brain, our bones, our muscles, our weight, our heart, our blood glucose levels, but that really doesn't help our skin. So being on a very good skincare regimen prior and after a procedure will actually help a patient benefit the most for that investment that they're making. The next thing I'll mention is the word relax, or R for relax. That refers to relaxing lines. This will refer to injectables such as Botox or Dysport. There are some others as well that are now on the market and are coming to market. These are about softening or weakening the lines that we make when we are using those muscles for the expressions of daily communication. Our face is an agent of communication, and there's no reason that we couldn't soften some of those hyper expressions that we make that are giving these lines over a lifetime so that we don't look as tired or as angry and look more relaxed or weathered. The third R that we'll refer to is refill. As we grow wiser, as I like to tell patients, we are losing fat, we're losing bone, the muscles will shift in our face, and that will create a change in the structure and shape of our face. I always say here in Southwest Florida, a very unusual population, much like a unicorn, is that 18 to 22-year-old, which we don't have a lot. But if you can find those individuals around here, you'll notice that a nice healthy look is almost like an egg-shaped silhouette of their face. As we grow wiser, things tend to drop, not because of gravity. We actually lose the bone and the fat that was holding a lot of our face up. So I always like to tell our patients that we want to be more like an apple, not like a pear, where we're a little bit bottom heavy. So filling is often approached by correcting the mid-face first, right around the cheeks. That's where we communicate. That's where we're looking at each other, and that's where actually you get the biggest return on your investment. Patients, particularly women, will often come in asking for your laugh lines or the marionette lines around the mouth first. I always try to bring them up to the cheek because I always try to tell them no one's looking at your mouth when they're talking to you. That's awkward. You wouldn't want to talk to someone if they were doing that. They're looking at your eyes. That's why there's that phrase, look yourself in the eye, because we don't. Because in the mirror, where are we looking? We're looking at our mouths. So always try to say, let's start with our mid-face first with our corrections. Let's work to our lower face, our lower third of the face for correction. And that usually provides a very good comprehensive approach. As women are very thin as they get older, it really can suck the face out in thin women. So another area that is often under-addressed, and I try to address it with women, especially the thin runner type of look, is the temples. So women will often become a little atrophic in the temples, and that will age them. So actually rejuvenating that area of the face actually has a tremendous benefit, providing that egg-shaped look again. The last one is resurface, and the way resurface is really nothing more than a segue to talk about browns, reds, and wrinkles, okay? When we have browns, we collect brown spots over the course of our lifetime due to sun exposure. In addition, the blood vessels in our face will dilate as a result of either rosacea, so some medical conditions, or even just from certain ethnicities this will happen, or just too much sun over a lifetime. And that will give a sort of rosy look. Studies have shown that when you improve the redness of one's face, they actually look healthier, not necessarily better. But as all studies have also shown, that when we look healthier, we look better. If you're interested in looking more healthy and youthful, please give us a call at 239-732-0044 or visit our website at skinwellnessflorida.com.